Welcome everybody to today's webinar about hospital administration. We'll talk about the different roles that you have an opportunity to apply in hospital administration, the competencies required to perform in those roles, what education opportunities you have to acquire those competencies. My name is Sandy Preddy. I'm the course director for the Graduate Certificate of Hospital Administration. I'm based in the School of Medicine, Deakin University, Australia. Before we get to the presentation itself, a couple of housekeeping matters. The presentation is scheduled to be approximately 30 minutes, and the webinar will be recorded for later viewing. We won't be taking live questions, but we encourage you to leave your questions in the chat box in the GoToWebinar functions, and also you have an opportunity to email me through the email address in the presentation slide. Bit about myself. I have a medical background, including working as a clinician in hospitals. I also have business qualifications and training. Further, I have a PhD in hospital management. In addition, I've managed healthcare projects in Australia, New Zealand, and Denmark. If you want to know more about me, please visit the link displayed in the presentation slide. The point for today's presentation is that we'll be talking about what hospital administration means, what are the different roles in hospital administration, and what are the career prospects for hospital administration, and what competencies do you require to perform effectively in a hospital administration role, and what education choices you have to acquire those competencies, and what we, through the Graduate Certificate Hospital Administration, offer so you can gain those competencies. Let's look at the definition of hospital administration. So this definition talks about the expertise required to administer, plan, organize, direct, and monitor the outcomes of hospital services. So as you can see, you require a wide-ranging skills to manage hospitals. A more simpler definition would be hospital administration is the competency required to manage hospital services. So the key word here is competency, and we'll be spending a bit of time talking about what competencies are. So what are the different roles in hospital administration? Starting off with the very senior positions, what we call the C-suite roles, including the Chief Executive Officer, Chief Medical Officer, Chief Nursing Officer, Chief Technological Officer, and so forth. And then you have the second and third tier positions, like the managers, managing different parts of the hospital, including the inpatient wards and the outpatient departments. Also, you have directors of various clinical departments. And further, you have people managing various service functions like finance, customer care, and marketing. Here, you can see various advertised hospital administration related administration roles. You will find literally hundreds of roles being advertised. And what do these roles do? If you look at it at a high level, a hospital manager not only has to manage the operations, but also has to take into consideration the big picture. I'm talking about the political and economic context. Also, the manager has to identify changes to improve business processes, but also improve outcomes for their patients. Further, the manager has to balance the financial and the seamless service delivery. If you look at the granular level, the hospital manager has to prepare funding estimates, allocate budgets for new services and for existing services. Also, the manager has to focus on improving the quality of health services and represent the hospital in various settings, liaise with community and media, discuss with them what the hospital offers, and improve the business. And further, they have to also manage staff in their respective. In their daily roles, they also have to interact with the medical and nursing and other professional staff. They also have to negotiate enterprise bargaining agreements, develop policies and procedures, but most importantly, of all the functions, they are focused on improving the patient experience and the patient outcomes. And this is really critical. How are the career prospects for hospital administration roles? So here I've pulled out data from the US. In terms of career prospects, compared to many other positions, the salaries are very high with hospital administration role. It's not only the salary, the US Bureau of Labor states that there's going to be a 20% increase in the number of hospital administrator jobs in the coming years. So definitely in terms of career prospects, it's a very happening area. So now we discuss the career prospects, the different roles, but what exactly to perform in those roles? Based on data, advertised positions and elsewhere, here you see they require some common elements. One of the most common requirement is a qualification in healthcare management or hospital management. In the past, you used to have employers being satisfied just with experience, but it's no longer the case. Quite commonly, many job advertisements require you to have a qualification in specifically in healthcare management or in hospital. If you're applying for senior roles, you would also have to have prior healthcare or hospital management experience. Education and experience are two of the many components. You also require analytical skills, technical skills, and communication and leadership skills. The International Hospital Federation outlines particular skill sets required for a hospital administrator, which you see in front of you. As you can see, there is the leadership component, business skills, of health and healthcare environment, what is happening contextually. You also need to have professional and social responsibility. It's an accountability factor. You also need to be able to communicate within the organization and externally, also manage relationship between stakeholders and the health service. So now that we know what are the competencies, where do we get these competencies? At this stage, the best way to gain those competencies is through completion of a qualification from a recognized university. But when you look at the courses are focused on healthcare management, there are very, very few courses that actually look at hospital-based competencies or hospital management itself. With hospital being a complex structure requiring dedicated skills, you may not acquire those skills through a generic healthcare management course. Also, many of these courses don't teach you the business skills required to prepare budgets, to monitor costs. If they offer all this, they don't have the flexibility for you to do it from where you're located. They require you to travel to a different country or to a different city. In case they are flexible, there is no guarantee about the quality, and if the quality is not right, your learning experience will be diminished. If you have all of this and you don't have industry input into the development of the course, your learning experience won't be optimal. So what can be done about this? To introduce the Graduate Certificate of Hospital Administration, where we strongly believe we address all those gaps which I've recounted in the previous slide. I'll quickly recount what are the salient features with the course. It's a 1-year course and it's a 4 credit point course. In other words, what it means is that we have 4 subjects that you need to complete to graduate from the course. It's offered fully online. What it means is that you can do this course from the comfort of your home, from your office, from any internet connection. We are also very pleased to say that the course has involved people with considerable hospital and industry experience, and we also involved guest lecturers and subject matter experts to develop the curriculum. And this course is not specific to one country. You could be from any part of the world, graduate from this course, take the learning and apply it to your own hospital. So it's geographical neutral. Already explained, this course is focused specifically on hospital competencies. That means that when you graduate from this course, you will get the necessary competencies required to manage a hospital. I'll talk about those competencies a bit later, but as I recounted earlier, it's a very flexible course. Flexible not only because it's offered online, because you can enroll 3 times a year. Many other courses have one intake. What it means is that if you miss that particular intake, you will have to wait for the next year to enroll this course 3 times a year in trimester 1, trimester 2, and trimester 3, providing a lot of flexibility as to when you can enroll. Already discussed the online platform. We deliver the course through FutureLearn, which is a high quality learning platform. We cover the essential hospital management competencies, the 4 subjects that we cover. We have had a lot of planning as to what those 4 subjects should be, and I'll be talking about that shortly. And as I recounted earlier, we also involved industry experts, and also the people who deliver and teach this course have had substantial hospital management experience. Further, you will have direct and prompt access to the lecture. What it means is if you have any queries about the course or the content, you will immediately We are also one of the most innovative universities in the world. We have a very high student satisfaction rate, which is really important in learning. And lastly, but importantly, it's very, very economically priced compared to many other courses. So how does the course structure look like? So the course is going to commence in trimester 2 in July. You will start off with hospital clinical governance and hospital financing. Once you complete those 2 subjects, you move on to trimester 3, and then you complete hospital digital health and hospital operations. When you complete those 4 subjects, in case you join in trimester 3, you commence with hospital digital health and hospital operations, and the following trimester, that's next year, you will complete hospital clinical governance, hospital financing, and then graduate, so forth. So there's a lot of flexibility when you can enroll, and once you complete the 4 subjects, you graduate from the course. Now let's look at individual subjects. You want to know what competencies you acquire, so let's discuss that. So the first subject is hospital operations. Flows hospitals and present strategies, concepts, methods that can improve the delivery of patient services. So how do you learn that? You learn that by learning about toolkits, various tools like queuing, scheduling, capacity planning, process design. Through that, you'll be able to not only understand what causes delays in hospital, but also get what solutions you can apply to address those delays. The way we teach this course, not just this subject, but all the 4 subjects, is by using case studies. In case studies, that makes the learning more effective. I see how in different hospitals across the world, they've used theories and tools to address patient-related issues or hospital-related issues. So that was hospital operations. So the next one, which we think is also important for you to learn, is hospital financing. As you can realize, financing is very, very important in the hospital context, in the healthcare context. So in this unit, you will develop the knowledge and skills in raising funds for hospital service delivery. You'll also have an understanding of funding sources are available and how you can allocate funds or how you can receive those funds. We also talk about how financing systems work in different countries, economic principles, and so forth. We'll also teach you how to prepare hospital budgets, business case, and monitor costs, which are very important if you're a hospital manager to learn. The next subject is covering health informatics, medical informatics, or digital health. This is also very important in the hospital context because you're having a lot of new technologies being employed across the world. And through this unit, you will explore the fundamental concepts which underpin digital healthcare in hospitals. You will critically analyze the challenges involved in digital information systems and solutions, cost, usability, privacy, and security. You will also investigate what are the emerging digital technology solutions, what are the current solutions that you can use to improve hospital services. Again, an important competency you require to perform in the role of a hospital manager. The last subject it is clinical governance. So what does clinical governance mean? It means using resources to improve the safety and quality of hospital services. And we do not just teach you how to develop the clinical governance frameworks, but we also teach you how to carry out audits, use evidence-based medicine processes. In case there were mishaps, how do you address them, and use technology to minimize patient safety-related risks. So these are, again, important competencies required as a hospital administrator. We are very fortunate to have academics who have had a substantial and a significant hospital management experience. All of the academics involved in teaching this course have been involved with hospital management. They also have wide-ranging knowledge of various theories being used in hospitals. So you will have direct access to these lecturers when you learn from this course. Now that imagine you're enrolled into this course, you completed the 4 subjects in the course. What are the competencies do you come out when you graduate? So you will develop the skills and capabilities required to manage hospitals of different magnitudes and specializations. Whether it's a secondary level or a tertiary level, you will have enough competencies to manage those hospitals. You learn cutting edge hospital management theories and also learn various tools that you can use to manage delays and other hospital related issues. You will also discover various strategies to improve the hospital business end, whether it's the cost or whether it's the efficiencies or the quality. You will also have studied various examples of how hospital theories have been applied. Hospitals have resolved issues. And finally, when you graduate, you will have the ability to apply these theories and methods to hospitals any part of the world. So what do you require to enroll or get admitted into the course? It's pretty straightforward. If you have a bachelor's degree from a recognized university, in case you don't have a bachelor's degree, you will need to have 2 years of relevant work experience. What do I mean by relevant work experience? When I say relevance, it has to be in relation to a health service management or a healthcare hospital management role or a profession situated within the health context. And once you fulfill those requirements, you will be able to be admitted into this course. In case you weren't convinced by my presentation, I encourage you to try the free taster course that's available through FutureLearn. You can see the link on the presentation slide. The free section of the course lasts only for 2 weeks, and you need only 3 hours per week to complete that particular week. And there is no obligation. You don't need to pay to enroll into this course. But by doing this, you will get a feel of how the course is delivered, the quality of the course, and what we teach, and the learning platform. And we've completing that free section of the course, you will be definitely interested in enrolling to the proper course. Finally, I would like to thank you for attending today's webinar, where we covered the hospital administration, the definition of hospital administration, what are the different career opportunities in hospital administration, what competencies you require to perform in that roles, and how the Deakin graduate certificate of hospital administration enables you to acquire those competencies. I encourage you to leave your questions either in the chat function or directly email me through the email address listed here. Thank you so much for your participation today.